Hi there. I am April Birdsong, nurse practitioner and functional medicine provider, and I want to talk to you today about what you look for in a provider, how you choose one. So, what have your past experiences been? When I talk to patients, many have become frustrated with the run of the mill conventional way of medicine. Are you tired of not being listened to? Or have your symptoms been just shrugged off as just being part of aging, the normal part of aging and getting older? Are you tired of long waits in the office only to be rushed through the appointment with the provider? And on that note, I do want to defend the provider a little bit because most are just caught up in the gerbil wheel of our medical system. And many would probably love to spend more time, but because of the way our system is set up, they're just not able to. I've been trained in conventional medicine and believe that it certainly has its role for sure. But after years of seeing so much sickness and comorbidities, many of those comorbidities that I feel and studies show are preventable. Years of this, plus my patients began asking me for alternatives. Instead of just getting the average kind of provider response, they wanted more. They wanted alternatives to the medicine and all those kind of things. So there was a missing link to many of these processes. There's not a deeper reason sought after when you're kind of going the conventional way. There really is not a deep dive into the root causes. My females ask me about options to hormone replacement therapy, options to pain management other than narcotics, to give you just a couple of examples. I remember one day after working at the clinic on my way home, on my drive home, I just was very frustrated because I had had a lot of my patients asking me these things, and I was frustrated with my own conventional training, and I wanted to have other answers and alternatives to offer. And that is when I decided to get trained in functional medicine as a provider. Functional medicine looks at the whole body and how genetics, how our diet, our gut health, and lifestyle all play a part in where you are on the healthcare continuum. On a personal level, I have always practiced healthy lifestyle habits, but once I dove into the functional medicine learning and training as a provider, I saw for my own personal health how much was still missing. And I want to help you get to the root cause of your pain, of your fatigue, of your weight resistance, and hormone imbalance if you have that, and come alongside and help you achieve your best health. If you can imagine a continuum where optimal health is on one end and sickness is on the other, my question to you today is, where do you fall in that continuum? And that's a huge question that you have to ask yourself. Have you run into a wall trying to figure out what your issues are and why you don't feel as good as you once did? And the answer is not, you're just getting older. I just won't accept that. I have seen on the front lines what comorbidities and being on the bad end of that continuum can do. And I want you to live in fullness and health. I want you to have a clear mind and not this brain fog. And I want you to be able to enjoy daily activities with your family and have a zest when you wake up. I talk a lot about having a healthcare team, a primary care provider, a dentist, an OBGYN, a counselor to help you work through depression and coping strategies. All of those things are great. And you should also have a functional medicine healthcare provider. I am not just a provider, I am a woman too. And I know what it feels like to have your hormones out of whack, to not be able to lose those 10 pounds, and sometimes to feel like you're really just going crazy. When you choose to work with me, you will get a provider who will listen to you and help get to the root cause of your issues. You will also get a woman who understands how you feel because I've been through similar issues. You'll have someone to help you with accountability and coaching you to help you achieve your goals. And accountability is a good thing. If you're tired of not having answers for your health complaints, or you just want to explore and do a deeper dive into your health to help you move closer to that optimal health on the continuum that we discussed, then join my Facebook group or set up an appointment today so you can begin your journey to optimal health. I look forward to talking with you about your particular issues. I hope you have a blessed day, and I look forward to hearing from you. And can't wait to help you get to feeling better again. Have a great one. Bye.